For the hearing aid user, the number one complaint is hearing, speech, and noise. With ACT, we're sending them out the door with the best baseline to do well in this situation.
So first of all, short and sweet. What is ACT?
So the audible contrast threshold test, or ACT, allows us to assess somebody's ability to separate or contrast speech from noise with a special signal that's actually non-language specific. It takes into account your pure tone audiogram, so this makes it an above threshold binaural test, and it's quick and easy to use.
So I see some very interesting perspectives here. So what do I need to get started?
Very simple, really. You need an audiometer with an ACT license. You need headphones or insert earphones, both will work.
Makes sense.
And you need a client response button. As long as the client can perform audiometry, they can perform ACT. The other great thing about ACT is because it's performed in the same way as you would do pure tone audiometry using a Houston-Westlake method, 2 down, 1 up. It's really, really simple for clinicians to understand how to use it. So it's really quick to learn.
I'd love to see how it's done. Can you show me?
Yeah, absolutely.
Okay, so we're ready to go?
Yes.
And I can see that you have the audiogram on the screen there, and that's because we need Susanna's audiogram in order to calculate that the levels that she's hearing is appropriate for her.
Absolutely, they need to be clearly audible.
Okay.
That's what makes ACT different. So we need to ensure that when you do complete the audiogram, that you have stored thresholds at 250 hertz, 500 hertz, 1 kilohertz, 2 kilohertz, and 4 kilohertz. Those are the mandatory frequencies. Once you go into ACT, a box will populate with some instructions for ACT. So it gives the clinician some guidance as to what to say and how to instruct our client.
Yeah, so that you know you've remembered to say everything.
Exactly. And there are also some sound examples within this portion here, which will allow you to familiarize your client so they know exactly what they're doing in the test. Would you like to pop on the headphones, Susanna, and we can get started? So, ready?
Yeah, I'm timing you.
Okay, go.
Okay, she responds now, so that means you make it softer.
Absolutely. And it's in the same Houston-Westlake procedure. So, down by 2 steps and up by 1 if she doesn't respond. No response.
Wow, that was quick, 1 minute and 34.
Yeah, I mean, Susanna has done this test before. On average, it does take roughly 2 to 3 minutes. But as you can see, we have our ACT value.
So now we have an ACT value for Susanna.
Yeah.
Now what? What's the next step?
Well, with ACT, the whole purpose of generating a value for ACT is so that we can help those with hearing aids with their number one complaint, and that is to hear speech in noise. And this is where Susanna comes in.
Right, because what do you do with that complaint today? Right, in the clinic, for 100 years, we've been doing a pure tone audiogram. And that's all well and good, and it's a very important tool for us to have, but it doesn't directly address this concern that our users have. So we now have a tool that we can use to test above threshold and get that information to give the people the amount of help that they need in this situation. I think as a hearing care professional, the fact that you can address this pain point for the user and say, now I'm testing you at a level you can hear for a problem that you have, hearing, speech, and noise. I'm going to use that to fit your hearing aid in the right way. I think that's very powerful. It's a good way to establish trust and credibility very early on.
So that's quite an interesting point that you're making here, because you're talking about the relationship between the client and the clinician and how this can be promoted through ACT. So how do you go about this? How do you see this?
Well, what we're presenting here is new territory for our hearing care professionals, and I think, frankly, for the field of audiology, because you're now able to take this single act value, one act value per person, and use that to prescribe the right amount of help. We haven't had that before. We've used speech and noise tests more for validation purposes and for counseling, and those are also very good pursuits. But I think having something to help you up front, set the baseline correctly before you send your patient out the door, that's the valuable part where ACT can do something new.
Okay, so how does this prescription work? I have an ACT value, and I can implement that into my Oticon Genie 2 fitting software. And what then happens? Can you elaborate a little on that?
Well, I think any hearing care professional will tell you that they're not going to fit a hearing aid without a fitting rationale. And we use these either generic or proprietary fitting rationales to set the gain correctly for your client, right? So have that starting point. But as it stands, we don't really have any guideline or directions from anywhere telling us how to help them in terms of the complex listening environments, hearing, speech, and noise. So with this, we give that direction, we give that prescription. And that's what it's essentially, if you want to put it simply, a fitting rationale for help in noise.
Okay, so you just type in the value and then that prescribes the help in noise that you would need for this particular client.
Yeah, actually, when you once you've measured your ACT value, it will either automatically get integrated into the fitting software via NOAA, or you can manually enter it, and then you have it there, and the prescription will automatically happen. We actually do have a fitting guide for this, but the actual steps, it's I think 3 steps, because it's very, very simple. It does it automatically and instantly as soon as you enter your fitting software and you're in the fitting process.
Yeah. And essentially, the higher the ACT value that's generated, the more speech and noise help that client will need.
Yeah. It's a good thing you mentioned that, because we have different severity categories when you do an ACT measure. And they're very familiar terms, right?
Yep.
It's normal, mild, moderate, and severe.
Yep.
So they correspond to what we already know and use.
In pure tone audiometry. So it's very familiar to us, these terms.
Yeah.
Okay, so the higher the ACT value, the more help in noise the individual would have prescribed.
So I think if I give you a clinical example, right? If you have Peter and Sarah coming into the clinic, they both have the same audiogram. You measure the same audiogram. They're the same age. They come in. Normally, the fitting you send them out would be quite similar. But if you then add the ACT value to the mix, and Peter has a very severe ACT value and Sarah has a mild value, they're going to have different starting points going out. And that's the whole purpose, because you don't want to over-prescribe help or under-prescribe help. So in essence, it should help us make it easier to send a client out with the correct dose of gain and the correct dose of help from the hearing aid.
Yeah. So a better first fit, all in all.
Absolutely.
Yeah.
Are there any other aspects of the fitting where you see ACT as providing value?
Well, another aspect of fitting for help in noise is also, it'll maybe help you choose which hearing aid, which handles you need in order to accommodate the needs of your client. But I think also importantly, if your client has a more severe ACT score, it could be you want to emphasize assistive listening devices or counsel a little bit differently on expectations, what kind of communication strategies to use once they walk out the door. Because regardless of how we help with the hearing aid, they're going to need those extra strategies as part of their new life with hearing aids.
So I see a lot of interesting perspectives in this, and I can't wait to get started. What do you see of future perspectives in having ACT?
Well, it has to come back to, we're addressing the #1 complaint of people with hearing loss and hearing aids, which is hearing, speech, and noise.
Yep.
We now have the perfect diagnostic test to quickly and reliably tell us what the extent of the problem is for the individual, and we can apply the right amount of help when we have that. So for me,
Exactly.
that's the essence of it.
Yeah.